delivering a quality service. We welcomed the Keogh team and their review, who commended us on the caring and compassionate attitude of our staff. They also reinforced that we were on the right path with the delivery of our services. We are reviewing all of our services across the trust, and the Keogh review team reinforced that we were on the right path with all of those measures.
With the review which you've got ongoing at the moment, was that prompted by the Keogh review, or was that something which was underway already?
It was something that we were doing as leaders within the organisation, that we are continually reviewing our services, and we welcomed the Keogh review team as it reinforced that we were, as I said, we were on the right path. And certainly around our patient experience initiatives and getting the quality of our patient care right, they agreed that whilst we had work that we needed to take forward, we were doing the right things.
Now, obviously you mentioned that there was a lot of things which were commented in the report, which I accept. I had a very, very quick flick through, and it did seem there were some good practices which were highlighted in there, but however there were also some negative points which were made. One thing which particularly stood out to me was the lack of systematic approach in place to ensure collection, reporting and action on quality of services. I mean, what would be your response to that?
That was one of the measures that we were already reviewing,
right,
and what that's actually referring to is that the quality of, the reporting on the quality of our issues is shared across the organisation.
Yeah.
So that was about learning from incidents, learning from positive experiences, and ensuring that all of our staff were aware of what our quality measures were about. As I've spoken about before, our consistent message around our patient experience initiative is that every staff member in this organisation should treat a patient as if it was a member of their family.
Right, okay. Now, it's interesting what you mentioned there, because there was also some communication between both staff, the junior staff, senior staff, and with patients and families. I mean, what would you say to that? Do you think there is a concern there?
I think there is always room to improve upon our communication, and for our staff, I think we need to adapt to the century that we're in. So there are different forums for communicating with staff. So we have open forums with our staff to talk about what's happening within the organisation, but we're also considering other mediums such as Twitter. How do we get into the electronic age? What do we do around things such as Twitter and Facebook? And certainly for our patients and their families, it is about listening to their stories, listening to them, and listening to the experience that they've received at Burton, so that we can learn from them on how to improve our services.
Lovely. Now, there was another thing which was mentioned with regards to communication particularly, about staff being unable to articulate the concerns that they have about perhaps what they see as things which aren't so good in the organisation. Do you think that that's something that is in existence at Queen's and at the other hospitals in the Trust?
What we've done here, certainly at Queen's, is actively encourage our staff to raise issues. So we have a very robust whistleblowing policy, but our view is that if staff have concerns about any care issues or anything around the quality of care, then there is a process for how they escalate that to seniors. So it's fundamental. We need to learn from our staff, we need to learn from our patients.
Yeah. So what about the future now? Obviously, I understand, unfortunately I haven't had the opportunity to read it, but I understand there are some action points which have been laid out by the review panel.
Yes.
How does the hospital intend to carry those forward?
There are 6 urgent actions from the review team which we've already taken action upon, and we're already working on improvements. And for the report in general, we're looking at instigating all of those measures within well, we want to instigate it as soon as possible. But what we are looking at is sustained change. So if we're changing or improving on our care delivery, then we want to ensure that it's maintained and that it's something that happens continually.
Yeah.
The 6 urgent actions we have already taken action upon.
Lovely. So in the way that you said that, do you agree that there has been quite serious problems at Queen's and obviously the community hospital also?
I think the NHS is facing an unprecedented challenge currently, and Burton Hospitals is one of the hospitals that was facing those challenges. One of the key recommendations in the report is to review and look at our staffing levels. That was something we had already done. We've reviewed all of our nurse staffing levels on every ward. We've recruited 49 registered nurses since February. We're taking on another 18 newly qualified staff nurses in September, and we're committed to continually recruiting because, as I said, it's about sustained change. So we're also seeking overseas recruitment from Portuguese nurses, and I went to an overseas agency on Friday to start recruiting, and we're hoping that they will be with us in November. Because they are of a good calibre, their delivery of their patient care is excellent, they've got a proven track record, and we want to recruit proactively. We have newly qualified nurses ready from September, but not for the number that we need, so we want to be ahead of the game, really. Lots of other trusts are seeking overseas recruitment, so again, we want to get there before they do.
Yes, yeah. Obviously the report only came out today. Was it what you were expecting?
Well, we've only just had sight of it, clearly, so we're in the process of digesting it. I think what the report and the review team have confirmed is that the measures we were already taking were the right ones. But there is room for improvement, and that's what we're taking forward.
Are there any plans to address maybe not staffing issues in terms of actual hospital staff, but a more senior level? Are there any intentions to try and reshuffle or rearrange any of the staffing at the senior level to maybe deal with some of the complaints here, or
some of the complaints?
Sorry, complaints in terms of the concerns that have been raised. Are there any changes at the senior level which might be taking place to deal with the concerns?
I'm sorry, I wasn't quite sure what you meant, but yes, you're meaning specific response to the review.
Yeah.
Well, what we're looking at is we need to digest the review, so clearly you'll hear within an hour of the report being published, so we need to digest the information. We have a leadership team who are absolutely committed to delivering quality service within this organisation, and I think what we need to do is reinforce the work that they've already started to do and take that forward.
I actually think I only have one more question for you, to be honest.
That's very quick.
Why is Helen Ashley not conducting these interviews?
Helen Ashley, unfortunately, is away.
Right.
The review team, the date for the review has been postponed, so it should have been over a week ago. Yeah. And unfortunately, she's on pre-book leave. She has been in daily contact with both myself and the medical director and the board, and we've had daily dialogue around the outcome of the review and certainly the launch of the review today. The report. It was pre-booked. Unfortunately, she would have been here. It's simply because of the fact that the review was put back. So that obviously was delayed.
Lovely. Actually, I do have one more question for you, if that's all right. If I understand, you're fairly new to the role here, aren't you? You have been conducting a bit of a review yourself, really, haven't you, as far as I'm aware?
Yeah.
How does this and the findings of this report coincide with the review which you've been doing? Are you finding that they're supporting one another, or?
Absolutely. I think it's reinforced some of the things that we'd already started to do. Certainly, one of the first things that I did was review our nurse staffing levels on every board. That's reinforced that's something that we need to take forward, and the actions that we had planned we need to execute quite quickly. One of the other things that we're doing is we're going to release our senior sisters to work in a supervisory capacity, so they'll be setting the tone at ward level. Again, the report recommends that that's a good thing to do. One of the further measures that were planned from when I started was to relocate the complaints department from this building into the main hospital, and again the report recommends that we should do that.
Right, so they're very consistent with one another then, so you must be quite pleased it's
absolutely,
to reinforce what you think.
It's a good thing.
So yeah, marvellous. Anything else that you would like to say?
No, I need you to stop that. That was very good, very quick. Very slick.
No,
don't put that on the website.